Hi everyone. If you don't know me already, I am Kathy, your host. I'm a certified postpartum and infant care doula, village building expert, mum, and the founder of Pregnant and Popped. I hope you remember when the guys from the Osteopathic Centre recently dropped into the village WhatsApp support group to find out what they could help you with the most. Well, it was this. And honestly, it is so often this, or related to this anyway. We are talking about breastfeeding struggles, but it's more than that. Latching, or should we say oral function, is about so much more. It's how they latch onto a breast, but also how they suck on a bottle, how they chew food, how they tolerate texture, how they breathe at night, and how they even speak in the future. Paediatric osteopathy touches upon all of this. Greg and his team are no stranger to us at Pregnant and Popped. They have actually been attending every fair since November 2022, and they see countless village members to support their baby's development. Greg has a reputation with the babies. We call him the baby whisperer, and we feel privileged yet again to have his support in bringing evidence-based answers for you and your little ones. The educational content of our masterclasses is the work of our Pregnant and Popped providers. We are not licensed medical or legal professionals, and this is neither a medical nor legal platform. The content of today should not be considered medical or legal advice. Instead, it is always best to consult your specialist providers for any specific concerns or queries. Use the information from today as a complementary tool to help guide those discussions and care plans. In short, our goal is to provide a supportive and informative community for expecting and new parents, but it's important to always prioritise your own health and the advice of your specialist providers. Right, Gregory. Gregory is an osteopath and the director of the Osteopathic Centre, based between clinics in the CBD, Orchard Road and Siglap, so all over the island. He has worked in both London and Singapore and has supported countless members of our community. He has a special interest, and dare I say skill, in treating prenatal and postnatal women and newborns. We love him for his skill set and mastery with paediatrics, but he is the first person to also shout out for the dads and make sure they feel supported too. He's known for his helpful, kind explanations for how parents can continue to support their baby's progress at home after every consultation. And we love that he is with us today. Greg and I are going to swap over our screens now.
All right. Hello, everyone. Hi, thank you, Kathy, for the nice introduction, as usual, and the support from the team. It's always a pleasure to be part of the village and come to the fair for that many years. So as you said before, as Kathy introduced me before, I'm Gregory. I'm French osteopath, and I've been in Singapore for now a good 8 years, starting to work in London and arrived here in 2017. So since I've been in Singapore, I realized that there was a lot of support needed for the world of pregnancy, including the dads as well, but especially the moms before and after pregnancies. So as I work within the world of osteopathy, let me explain what osteopathy is quickly. Osteopathy is a manual therapy that is mainly based on working with hands and without medication. So when it comes to adults, I'm sure a lot of people are aware of what we do. It's a bit of a mix between what the physios and the chiros do. So we basically work on helping with mobility, releasing pain and restrictions in joints, muscles, musculoskeletal system in general. When it comes to babies and newborns especially, it's the same principles, but obviously the techniques are a bit more gentle. And just to make sure that it's clear, we don't do any cracks or any joints manipulation with the babies, as it's a very gentle maneuver from the beginning to the end of the session. So that's about osteopathy and me. Now, why we're here today is to talk about the latching and latching issues with your newborn. So I see a lot of moms postpartum who come with the babies who are struggling with breastfeeding and especially latching. Latching can be on the breast, mainly on the breast, but also on the bottle, even if there's less issue usually when it's on the bottle. So we're going to focus more on the breastfeeding, but we can talk about bottle feeding as well. So as I said, we try to help with supporting everyone, the moms and the babies, when it comes to feeding, and also for the future when it comes to talking, speech, solid food, and everything that is related to the development of your baby. Let's start with a few conditions, if we can call them conditions, that we see in clinic, so you can relate. There is a lot we can do with the babies, and after their birth, latching difficulty is one, but as you can see on the list, there is a bunch of issues that you can encounter and then we can help with. So it goes from breathing, digestive issues, neck restriction, torticolis, and I will explain what torticolis is in a bit, and of course everything that is related to the oral development, including the tongue development and the latching difficulty. So latching your baby can be quite, I would say, challenging. And as I like to say in clinic when I see my patients, is that it's obviously a team effort, right? So it's if there is an issue, usually we try not to blame anyone and not to blame either the mom or the baby, and it's a work that everyone needs to do together, and it's not as easy as everyone see on Instagram or in the movies. It's real life and it can be challenging. So it's a team effort, including the dad, obviously, of course, but it's a team effort between the baby and the mom. So the usual symptoms that are showing that there is a breastfeeding or feeding or latching issue in general is coming from the baby. It can be sounds, chopping, shallow latching, clicking sound, biting on the breast or on the bottle. Also, the babies can have a sense of fatigue or get very fussy when it comes to feed. And it can be very challenging before when it starts being challenging, actually, the whole routine of breastfeeding can be a bit broken, and it gets very hard to follow that routine, actually. So those are the main symptoms that we usually observe in clinic and that we're trying to work with. Another one that actually the mother can experience is the breast engorgement, and that's usually due to latching issue or a lack of milk getting into the baby's mouth. And of course, if the baby has a shallow latching and some kind of biting latching, it would create pain for the mom and soreness to the point where you want to or you don't want to breastfeed, and you kind of feel like you want to give up, which is the most challenging part usually. So understanding why it happens and how it can be improved would help and would be the key for a breastfeeding that goes smoothly. So the latching usually come from the latching issues, can come from different challenges and restriction. So if we start with thinking of the baby itself and looking at it from an osteopathic point of view, which is very musculoskeletal, the oral function that is based on joints, muscle, and of course nervous system can have an effect on how baby is gonna latch. So to give you a simple example, if the baby jaw is too small or too tight or doesn't open wide enough, that can have an impact on the way baby is gonna latch, and then actually have an impact on the way the mom's gonna react and how you're gonna deal with it. So that's the first, I would say, main reason why the latching is sometimes an issue, is the tension in the jaw. But this tension in the jaw can also be related to some other tensions somewhere else. for example, the neck. So if the baby's neck is stiff and not moving enough, the jaw function is going to be affected by that. So those tensions can have an effect to each other. And to that, you can add what happens often is a tongue function inability. So if the tongue is not doing the work that it should do, baby is going to struggle to latch using his tongue properly. It's probably going to be affecting the mouth and the way it opens his mouth and create some stiffness. And then it becomes a vicious cycle where nothing is working accordingly. And this can be looked at it from different angles. So the neck stiffness can lead to a jaw tension, and a tongue tie that I will talk about in a bit can also lead to a jaw tension that can lead to a neck stiffness. So it's never one thing, it's not often one thing leading to another, it's often everything together working as a whole that doesn't function properly. We didn't talk about the birth, but it's where everything starts. Usually, a birth creates a lot of tension. It's a very challenging moment for both protagonists, I would say. And depending on how the pregnancy went and how the delivery and the birth go, it can have an impact on the latching. I will give you an example in a bit, but birth is a traumatic moment. It's often a traumatic moment for baby and for the mom, and it can be causing a lot of tensions in general. So to give you an example of what birth can be traumatic is usually when things happen not accordingly. So if the baby gets stuck in the canal, it can lead to the use of tools. And that's what I see a lot of in clinic, is baby who were actually delivered with the use of forceps or vacuum. So I like to use this comparison, but if you as an adult sleep in a funny position and wake up in the morning with a stiff neck, it's kind of comparable to what happens to a baby who's got delivered with a forceps. It pulls on the head, it pressures on the jaw, and often creates tension in the neck. If the neck gets tight, as I said before, it can have an influence on the actual jaw, and everything tightens up, start to guard, and doesn't move how it should. So there's a big interrelationship between the birth, the use of tools, and the effect on the neck and the jaw. So working on that is, I would say, mostly what I do as an osteopath, because working on the mobility, the restrictions in the muscles on the joints are key. And this is the main approach that we have on postpartum issues when it comes to breastfeeding and latching. Now, I want to focus a bit on the tongue, because you probably all heard of tongue tie. A tongue tie, everyone has a tongue tie. So the tie, what we call tie, is a little string between that attaches the tongue to the bottom of the mouth. This string can be more or less long and keeping the tongue in when it should be going up and forward. So most of the tongue tie, when they're very prominent, that can be diagnosed at birth. And then the doctors and the health support would help you decide on whether you should snip it or you shouldn't. The usually challenging issues are when the tongue tie is not that prominent, but we tend to think that it has an effect on the latching. So the way we deal with tongue tie release are very much covered by pediatric dentists and pediatrician in general. So as an osteopath, I'm not giving you diagnostic on the tongue tie, but I can give you my thoughts and redirect you to a pediatric dentist if I think it is necessary. It also works both ways, and the way it works most of the time for me is that parents would suspect a tongue tie because of the pediatrician would have observed it and would go to a pediatric dentist if it needs to be removed, and then would come to me for the rehab work, I would say. If the patients haven't been to the pediatric dentist and suspect a tongue tie, then I would observe, assess, and give you my thoughts, but wouldn't do a diagnosis per se. So back to why it affects the latching, it's pretty clear and easy. If you think about mouth getting on a bottle or on a nipple and trying to grab it and vacuum it to be able to suckle on the milk. So the tongue has to be functional and move a certain way. If that vacuum movement doesn't happen properly, then the latching becomes a bit dysfunctional and the milk intake is not happening. So that's also linked to the mouth and the oral part of it, which is how the mouth move and open. So if the jaw is tight and the tongue tie is a bit too overdeveloped, it's going to cause even more trouble to latch properly. Which doesn't mean that if the tongue is working properly, the jaw is opening enough, and vice versa. So it's always a bit challenging to find what is causing what and what's helping. But that's exactly the purpose of our sessions. Back to the jaw. So as I explained before, the jaw is what actually has an effect on the opening of the mouth. If the jaw is tight, the mouth is not opening enough. If the mouth is not opening enough, this can have an effect on the tongue function again. What I explain usually to patients is that we all have very strong jaw and clenching muscles. So those muscles that we can actually palpate ourselves, if we bite, we feel them. And if those muscles in babies are tight, the opening is going to be compromised. So it's pretty straightforward. Tight muscles, we can't open our jaw properly. Loose muscles, we can, and it helps with the tongue and everything that goes together. Tongue, jaw, and neck. So neck is also a big one. And I don't know if you guys are familiar with this word torticolis, but it's a technical word to describe a tension in the neck. So everyone has a rotation muscle in the neck that helps turning their head. In babies, when there is a tension caused either at birth or after birth for different reasons, that muscle can get tight. It's the one that you can see on the photo. It is the big one that we all have there. So if that muscle gets tightened, stiffened for different reasons, it would hold baby's neck in one position. And it's usually a rotation position and a side bending one. So baby is going to end up like this. So if baby is like this in this position, they usually would struggle to turn it to one side. And if they struggle to turn it to one side, they would usually struggle on one breast more than the other one because of the rotation of the neck. So this can have an influence on the way baby latch. And often I would see moms where baby can latch on one side and not on the other one, and I don't understand why. So in that cases, usually the tongue is not an issue, the opening of the jaw is not an issue, but the turning of the neck is, and it affects everything else. So this is how interrelated everything is. And it's important to understand that, because if the baby's neck is a bit stuck, it doesn't mean that their latching technique is not good enough. It's just because they can't rotate their head. And they would end up being fussy or being fatigued on one side and not on the other. And again, this can come from different for different reasons, mainly the birth, but also the position of baby inside. During the 9 months in the womb, baby can be a bit squished in one position, and it's again this exact same as us sleeping in a funny position and waking up with a stiff neck. So you stay in mommy's tummy for that long in the same position, you come out and you'll be stuck. You have a stiff neck that can lead to a torticolis and lead to latching issues. The other main reason, as I mentioned before, is the use of tools at birth, or I would call that like a sporty delivery, where the doctors or the surroundings have to help and push baby out. It can be during natural delivery, but also during C-sections, especially during emergency C-section, where baby has to be pushed quite firmly, and that can cause a bunch of tensions as well. Another little one that is not directly related to the latch is the colic, and I'm sure everyone heard of that before. Digestive issues, colic, gastrointestinal irritation. This is all usually under the same umbrella term of colics. And it's basically showing by baby being very fussy for no reason apparently, and usually very much in discomfort in the tummy area. So is that related to latching? It can, because if the latching is not efficient enough, or if baby is not latching well enough to not grasp air, it can cause irritation in the tummy. So that and then lead to discomfort and fussiness. So it's not a directly related latching dysfunction issue, but it can have an effect. And if the baby is not happy on the breast and we checked on everything and everything has been assessed and nothing is problematic in terms of how it works mechanically speaking, I would say, it can be due to a more indirect reason, which is often digestive issues. All right. So I think that's one of the most important slides. And as I mentioned before, we're not working alone, and being surrounded by all the practitioners and all the healthcare medical practitioners is very much key. So this is I think the good recap of everyone that work together when it comes to latching issues. So a lactation consultant, a doula, are the key people when it comes to helping osteopaths, and usually it works that way. You would be followed, you would be supported by a lactation consultant or a doula or both, and they would assess and they would suggest that there is a reason why the latching is not working properly. And if they think that it would be an osteopathic matter, they would redirect and they would send them to us. For the dentist, the pediatric dentist especially, it's very much related to tongue tie usually. So it can be before, just to have a diagnosis and understand if the tongue tie is an issue, if it needs to be released or not, or it can be coming from me, observing, assessing what I think a tongue tie is, and asking for the parents to go and double check and get a medical opinion on the tongue tie and then act accordingly. When it comes to the speech therapist, it's usually a bit later in life, but it can also be very relevant for newborns. But the latching issues, if we feel a bit stuck, everything has been checked on, the tongue tie is not an issue, the musculoskeletal system is not an issue, and baby is still struggling or have a bit of an aversion to food when it comes to usually to a bit later in life to solid food, then I would redirect to speech therapist. And of course, the pediatricians are here all the way from the beginning, and they are the ones that would assess and give medical diagnosis. Of course, the last protagonist of this journey and the main ones are the parents. And as I said before, it's all a big team effort and everyone needs to be working together. I think we're getting to the end. So latching is, to my opinion, something that can be quite challenging sometimes, not always, but most of the time we can come up with a solution using the whole ecosystem that we have around us.
Oh, wow, Greg, thank you so much. Can you give like an idea of what's the experience like coming in for an appointment with a baby, especially if they're young, you know, and let's face it, some of these issues people are feeling and facing often, not always, but often very early in their journey. So, you know, they might not be coming out that much. They've you know, visited the pediatrician, but maybe not gone anywhere else yet. So it's a big deal. Putting baby in that car seat, you know, coming to see you is a big deal sometimes with a newborn. So can you just like how long is an appointment? Kind of, have you got space between appointments? So if people feel they need to feed or like hang around, can they?
So, well, first of all, it's funny because administratively speaking, for a clinic, it's always a bit of a struggle to deal with timings and people being late. So, parents there, we understand you, and if you're a bit late, it's fine. And usually it's the case because we can imagine that everything's all over especially when it's the first baby, right? Everyone is all over the place. There's always something unexpected happening. So, no stress about it. If the timing is very tight, I would explain, or we try to reschedule, or we try to see you on the same day at another time, as much as we can. The sessions usually start with a little chat. So I liked, especially we see babies from 1 day old to 6 months and above. The usual age that I see is 2-3 weeks old. So obviously, a 1 day old baby, parents will be way more stressed about me or a stranger treating them than 3 weeks later. So I take all of that into consideration, and I think having a chat in the beginning of the session and talking about what I'm going to do and explaining what I'm going to do and how gentle it is key. Then usually, because we had the right communication beforehand, the treatment goes very well. It's after the chat, what we do is putting the baby on the table and see how they react. And I'm still explaining what I'm gonna do. I treat my way, which is I usually, as you could see at the fair, I usually treat baby on the ball because they love the motion, the movement, but not necessarily. It can be also on the table, but it's basically giving baby a massage. And that's the word I use with the parents and with the babies. And I tell them I'm going to give them a massage, and they're usually happy with it. When they're a bit older, it's a bit different. So a toddler, not a toddler, but I would say 1 year old, 1.5, or just before walking, babies are way more suspicious. So I would take some time to talk with the parents, give them this sense of safety, rather than jumping on the baby and treating them straight away, because it doesn't go well usually. Again, it depends on the baby, it depends on their personality, it depends on the parents as well. If everybody is stressed out or if everybody is in a good mood, it really depends. So I try to adapt to every single person, basically. And yeah, and to answer your question, that's how I lead the sessions. We chat, we talk about the issue. I tell them what I think it is and what we're going to do to help. Then we get to the practical part, which is treatment, massage. And usually after that, if there is any exercises or any stuff that I would like them to be able to do at home, we do it together. If they're happy with it, of course. And if I feel the need for the baby to come back, I would explain to the parents, okay, we need 3 sessions and we're going to reassess after that. Or we do 1 session and I would get back to you in 2 days. You guys tell me how things are, and we can act accordingly as well. Because I'm trying not to book people back for the sake of it, but just if they need it. And that's how I do usually.
Yeah, no, I've always felt very much osteopathy is the type of profession, like you said earlier, you're trying to do yourself out of a job. You're not the type of profession that, is constantly saying you need to come back for regular, regular, regular. It's
Or the
very
type
much,
of person. It
yeah,
depends on the persons as well.
yeah, yeah,
Yeah,
exactly. Exactly. But I know you guys at the Osteopathic Centre, you're really trying to find that solution in the
yeah,
most gentle and efficient way so that people don't have to, keep coming back, um,
yeah.
which is which is lovely as well. We've got a question, Greg, for tongue weakness, not so much a tongue tie. Can an osteopath help?
We can try. So it depends on what we mean by weakness. And I assume that what we mean by weakness is a lack of effective tongue function. So this can be challenging. Tongue weakness, tongue function needs to be worked almost in a training way. So to give you an example, if baby's mouth is opening wide, neck is moving well, and the only thing that is problematic is the way they actually latch and in a weak way, then it's a bit like training, working out to be stronger, to be able to do what we have to do. So when it comes to the tongue, it's a muscle. So we need to strengthen it and strengthen it in the right way, which means rehabilitating it almost. So to answer your question, yes, we can help. Is it straightforward? Not always. So just to manage expectations and how it works, I would say assessing the tongue, see if the tongue function on a finger, not necessarily on a nipple, is working properly, and then try to retrain and retrain until the strength has come back. But the most important thing is to assess why is it weak or why is it malfunctioning. So I would ask if a baby was diagnosed by someone or is it just what she's been observing.
Yeah, I obviously from a non-medical perspective, but working as a postpartum doula, I've aligned a lot of parents with osteopathy when they've had concerns around tongue weakness, suck weakness, um,
Yeah.
and I think the one thing that I've always felt was absolutely exceptional was the fact that with osteopathy, you can help provide the correct exercises, to do, and that support. I mean, I alluded to it in the introduction about how well known you are for really taking the time to explain to parents what they need to do at home. Like, because it's
So
not just
yeah,
what happens in clinic. You will do all the checks and you'll be able to check the progress and give all of the exercises, but it's that extra support. It's the going home and then carrying out those exercises that's the hard bit. And you've helped so many families really take the time to really explain those exercises to them.
yeah, that's what I'm trying to do. So as what I was saying about the parents and the team effort is basically trying to empowering everyone and empowering the parents to try not to see them again too soon, basically. So if we do, let's say that we try to understand what's going on with this weakness, I would go over all the exercises, and most of the exercises that I think can be applied at home, we do it together with the parents. So when I present it and when I explain, it might not make that much sense, but when it gets to a practical session, it usually makes sense, and I hope I can usually help parents to do it themselves, basically. So, and obviously trying to do as much as they can, and then get in touch or see me again to follow up on how they've been working at home, and then again trying to let them go home with more tools, more tips to be able to sort that issue out on their own.
Yeah. Oh, we do have a follow-up from somebody else. If baby gets tired to swallow after 2 to 3 swallows, can osteopathy help? So it's obviously a baby that's still learning this skill and getting quite tired.
Yeah, so it's interesting because again, like I think it's very much based on, I'll give you an example. So I've got a lot of similar issues. Parents would come to me and ask me why baby is falling asleep after 3 swallows. Yes, because they're getting tired, and yes, because they're probably not effective enough, but they're doing it well. So most of the job is done. Now we need to get them to do it for longer. And how does it work? Again, training, and try to get all the little stimulation, tongue stimulation, but of other stimulation exercises into place to do at home. But on these specific symptoms, which is the getting tired, it's often due to the surroundings. And when I say surroundings, I mean the rest of the body. So as I mentioned before, the neck can be tense or stiff. And if you try, you as an adult, to hold your neck that is already stiff and stuck from the night before in a certain position for more than 5 minutes, you're going to get tired. So it's quite similar. So what we do, if that's relevant, we work on the rest, which is loosening the neck, loosening the jaw, and trying to put the baby in the best position to be energetic enough. If that's the cause and the reason, the first thing we do, again, as an osteopath, is trying to find the root of the issue. So if the root of the issue is something else, then we need to act accordingly and maybe redirect to the pediatrician or anyone else.
Yeah, I've seen it time and time again with babies with underlying tension, and then once the tension is released, they become like different little babies, and then they are able to meet so many more of their developmental milestones. They start feeding, they start doing everything, along their little milestone kind of checklist.
Yeah, and it's interesting because when it's so different being in clinic and practicing as opposed to explaining, because when you do it in a practical way, you observe things as a parent that you haven't seen at home. Example, a baby has been crying for 2 weeks nonstop, comes to the clinic, parents don't know what to expect, and when it works well, baby can calm down, stress levels are going down for the first time in a week. And then parents realize that it's possible. So it's also showing that everything is fine often. And that's reassuring and motivating.
Yeah, it's obviously where you get the baby whisperer nickname from. And I hear clients that will desperately try and get that appointment time with you that is before a nap or before bedtime because the whole experience just turns them into like different babies that then happily fall asleep for a good nap or something like that. So I know pre-nap times and kind of end of the day are your critical newborn baby times. I know parents are fighting over them.
Yeah, but and parents are often stressing out about the timing, which it's not always that important because it's often almost better to get an angry baby to work on, to actually try to treat if it was happening at home. If the baby is already super calm, came from a nap and happy, it's great for everyone, but it doesn't show what's happening during the rest of the time. And it's, I think, useful to be able to work on a fussy or overwhelmed baby and get to something because it's very positive when it goes that way, which is baby is fussy, baby didn't sleep or didn't eat yet and is really upset, and we get somewhere. It's always very satisfying for both parties.
Yeah, I can totally imagine that. We've talked all around like latching and the various causes that it could be from, the difficulties, what the root cause could be. I think a lot of the time this gets kind of gobbled up in the conversation around tongue ties and lip ties. I know obviously you've spoken about those. I think in particular though, tongue ties is something that can end up with multiple professionals all wading in. Like, I think, when it's a latch issue that really is just due to tension, I think people know now to come and see you. I think with tongue ties in particular, though, you get this multitude of opinions at the same time. So where does osteopathy sit in particular on that? So if you've got a pediatrician and a lactation consultant and you guys, what is it that you're doing in that relationship, and what can you do to support the parent, whether they're having a correction done or not? Where do you sit in being able to support them when they've got all that noise coming at them?
Well, I think the correction, the release of the tongue tie is the main source of stress. So, well, if there is no need, if it's an obvious no need for it, great. So we will support, try to work on tongue function, stimulation, loosening every restriction, and try to work on everything at the same time. If the tongue tie is developed enough that there is a possibility that we need to do a correction or an intervention, this is a lot of communication, because not all the parents are taking that the same way. And for some people, it's just normal. It's not just a detail. For some other, it's not, and that's actually scary. And they just don't want their children to go through that, right? So if we are in a gray zone, do we need to do a correction or not? This is where usually the final decision would be taken by the dentist, and I would rely on them for that. So there's three possibilities, I would say. The first one is that there is no tongue tie. The second one is that there is a tongue tie, and this is the long gray zone, because there is a tongue tie, but is it affecting the latching or is it not? And this is the work of all the practitioners, pediatrician, dentist, lactation consultant, and me, all together to decide on that. It's never black or white, and that's why it's a bit challenging. Or the tongue tie is so obvious and so in the way that we need to do a release, usually.
And you support at every stage of that, don't you?
Yeah.
So
Yeah.
your skills apply no matter which of those scenarios happen, because if a tongue tie isn't obvious, you're still going to support with a physical remedy.
Yes. Yeah.
If it's the gray area, you're going to support with as much physical remedy as you can. And if it's a release that's required, you're then going to be part of the rehabilitation process, the exercises, making sure it doesn't reattach, retraining the tongue. I think a lot of people don't realize that the tongue needs to learn how to move again, like in a different way.
Yeah, exactly. And the dentist that is, if there is the tongue tie that needs to be released, usually the dentist, if they are within our group and aware of osteopathy, would actually redirect patients to us for exactly what you just mentioned. So rehab, stimulation of the tongue, exercises, and the post release work, basically. Yeah.
Cool, thanks for that. Because I know it's only one part of latching, but I think it's the part that gets the press. It's the part that everyone's talking about in a lot.
Because it's any part that is very gray and it's not a yes or no is always the challenging one, especially when you look online and you get like 10 different opinions at the same time, and then they're all different. That's quite confusing.
Yeah, absolutely. A couple of questions have come in. Is it still in time to get help if my baby is already 7 weeks old?
Clear yes. It's pretty, I'm not going to develop a lot, but like
7 months,
clear
7 years, I'm going to say. It doesn't matter where they are, they can help.
Yeah. Well, it depends. I don't know what the issue is, but 7 weeks sounds early enough for, depending on the symptoms, but if it's a latching issue, yes. So I would be happy to get more information, and but 7 weeks is a good age for treatment.
in terms of where the clinics are, you've got the CBD clinic, which is at Raffles Place. Yes?
Exactly. Yeah. Raffles Place. The one I'm at today is Far East Shopping Center in Orchard. And it's in Far East Shopping Center, not Far East Plaza. And the other one is in East Coast, in Siglap, to be precise, on Siglap Drive. So I'm usually going to all those 3 clinics in a week, trying to be everywhere at the same time. And the other osteos in the clinic are also working in the 3 locations. I'm the one doing pediatric work, but Ikra, that you know, does a lot of work with pre and postpartum as well. So for when it comes to newborns, it's me and Dr. Paul when he's around as well, the founder of the clinic.
Yes. He's all over the place now, though.
He's all over the place, so you might
all
not
over
be
the
able
place.
to see him,
Yeah.
but if he's around, we let people know.
We love him, but he doesn't have the nickname Baby Whisperer, Greg.
Yeah.
That's what you've got. And yes, I'm referring to Ikra. We will make sure as well that we link when we send out this to previous masterclasses that we've done with Ikra as well, where she's been able to explain what she does prenatally and postnatally with women, and a general shout out, because Greg will never let us forget the dads. He always makes sure that you do a shout out for the dads.
Yeah, well, that's just like the typical classic issue that the whole family gets usually is the mommy thumb.
Yeah.
So you have a newborn and you use your arm too much and you get inflammation in your thumb, and that happens to the moms obviously, but a lot to the dads too. So with the back pain.
Yeah, I say it time and time again. Everything we do as parents, we do with an extended thumb.
Yeah.
Whether we're holding babies, feeding babies, pushing push chairs, holding car seats, it's all with an extended.
Or looking online for solution. Usually, that's the main one.
Well, that's a nice tie-in, because our tagline for Pregnant and Popped is, because you shouldn't have to Google motherhood. So guys, you shouldn't have to be doing too much of this. You should feel like you are in a community and a village where we are all there to help support you. So worst case scenario, it's just one click and you can ask us, and then we can get the help to you. And often that help is Greg. So thank you so much, Greg. Really appreciate it. Your masterclasses are always well received. We always get a lot of people watching the replays because it's just so useful. So thank you very, very much for your continued support. Thank you to everyone for tuning in. So have a great day. Please do get in contact either with me or Greg directly. If you've got any questions or you want to arrange any follow-up advice, please do reach out. All right, guys. Great. Thank you so much. Have a fantastic day.
Thank you so much.